Thank you for the opportunity to present our data, our preventers information, sorry. So I'm going to talk about disparities in cancer care, research, treatment, etc., between private and public facilities in South Africa. Oops. So which one? Oh, sorry. I don't know what I did. Can I have this slide back in press? Oh, okay. How's this one? No, it doesn't work.
This one.
Okay. So I've presented this slide previously, and I just wanted to re-emphasize what I've done here is also put in the population. So if you look at the continent of Africa, it's a huge continent. Easily Europe, United States, and China could fit into the continent if you compare it by land mass. And if you look at the population, that is reflected largely in the population as well. With Europe, China, and USA combined, roughly 2 billion, in Africa 1.5 billion. So it's a large continent with a large number of people. And so in Africa, cancer is the 5th leading cause of death, followed only by diseases such as infectious diseases and infant mortality, etc. Roughly 1 million new cases are diagnosed per annum. This compares with the 2 million globally. Globally, there are about 10 million cancer deaths per year, with 70% of those deaths occurring in low and middle income countries. I think this was pointed out earlier by Dr. Valmus in his presentation. And with 70% of the cancer deaths in LMICs, those countries only have 5% of the total global resources for combating cancer. So there's a huge deficit there. And the 2040 forecast for the estimate of the number of new cancer cases is that it will double by 2040, and the number of deaths will increase to about 1.4 million per annum. So if you look at the different cancers in the continent, it may be difficult to read, but if you look at breast cancer at the top, the 3rd, and colorectal cancer, and prostate cancer, you can see those are basically continental problems. So the distribution is the same across all the countries in the continent. Then there are some cancers where there is a disparity between the eastern and western parts of the continent. So if you look at esophageal cancer, cancer of the esophagus, which is in the 1st row, 2nd from the bottom, you see that cancer of the esophagus, which is my area of interest, occurs largely in the southern eastern part of the continent, and it fades out as you go to the west. And maybe if I can answer Elizabeth's question about HPV, we looked at HPV in the early days with PCR, etc., and we found HPV present in our patients. However, with more recent, more sophisticated studies, whole genome sequencing of a large cohort of our patients, we didn't find any HPV sequences in the patients. Although the patients may be seropositive for HPV, there's no direct correlation that the HPV DNA is integrated into the tumor. So just a sidetrack there. You can see there's a great variation in the types of cancers across the countries in the continent. Okay, so this is not difficult. This is difficult to read. So what I've done, I've just taken a portion of the slide and enlarged it. And the idea there is just to indicate, if you look at the last column, that is the mortality incidence ratio. That's a ratio of mortality to incidence. You can see that the ratio is very poor. So a large number of the patients will die once they have contracted cancer. So the cure rate is very low. And for most of the cancers, maybe if you go to the presentation, you'll see it much more clearly. And the same applies, I've just enlarged some of the countries, and you can see that for the different countries, there is not a great difference in the mortality incidence ratio. In South Africa, if you look at the bottom half of the slide, South Africa has a slightly improved incidence to mortality ratio of 0.73, whereas most of the other countries are below that value. And so if you look at compare the mortality versus incidence in different countries, on the right you have the cancers, different cancers in Europe, and if you compare it with the different cancers, so the top one shows breast cancer. So the mortality in Africa is much worse than that in Europe. So that's reflective of both the diagnostic and treatment procedures in both those countries, in Africa. And also if you compare Africa with Asia, again, it's not in the same order because it's in decreasing order, but the mortality is slightly better in Asian countries, in Asia as a continent, than in Africa. So clearly the problems is that, or the causes rather of this disparity is that cancer care remains inaccessible to a large portion of the African population. There's clearly inadequate translational research. It's insufficient or inadequate diagnostic and treatment facilities. There's a complete lack of cancer awareness. When people contract the disease, they ignore it and hope that it will go away. And most patients go to traditional medicine and herbalist for treatment. So clearly, education and awareness is a problem. This is compounded by poor training of healthcare providers in both primary and secondary care facilities, and inadequate preventive, diagnostic, and therapeutic resources. And these barriers disproportionately affect the poorer populations in the countries and aggravates the existing health disparities in those countries. So what is being done in the investment in cancer care in these countries? There are many countries that acknowledge that the burden of cancer is significant. It places significant burdens on the healthcare system, but yet they fail to invest in improving patient outcomes, which still remains hopelessly inadequate. South Africa is probably one of the countries in Africa that provides, I would say, near equitable and access to cancer care. Not perfect, but however, the public health care system is vastly under-resourced, even in South Africa, and poorly managed. For example, many new generation biopharmaceuticals are generally not available at public hospitals. They're only accessible to people who can afford private health insurance to pay for those at private hospitals. But in public hospitals, those facilities and drugs are not available. So the public health hospitals are generally poorly managed, but the private healthcare facilities are well managed, well resourced, but not affordable to those without medical insurance. So just to give you an example, the gross domestic expenditure on research and development in sub-Saharan Africa is 0.44% of GDP. But those same countries spend 1.7% of GDP on military hardware. So the priorities are clearly skewed. In South Africa, the percentage of GDP spent on research and development is 0.85%, Kenya 0.81%, Egypt 0.72%, Morocco 0.71%. Those are the countries that spend the most on research and development. In other countries, in developed countries, for example, the expenditure is 3 to 5% of GDP. So clearly, the priorities on spending needs to improve. Investment in cancer research in South Africa, the percent of, or the amount of expenditure on research and development in South Africa is 28 billion South African rand, which is equivalent to 1.5 billion US dollars. So embarrassingly, when I compare that with most Western countries, it's a drop in the ocean. The South African Medical Research Council gets only 3% of that 28 billion to fund all health research in South Africa. And the South African Medical Research Council, in turn, spends only 0.5% of its budget on cancer research. So that's a measly 4 million rand. The Cancer Association of South Africa, which is a private agency, funds cancer research and runs patient facilities, relies on donor funding and spends much more than double that amount on cancer research and cancer care facilities. Research in South Africa is largely supported by funding from the EU, the NIH, NCI, Gates Foundation, Wellcome Trust, and it far exceeds the amount allocated to government funding agencies. So, for example, at the University of Cape Town alone, research funding coming into the medical faculty for medical research overall is more than the Medical Research Council budget for the whole country. So clearly the country is investing too little on research and development, and that needs to change. The Cancer Association of South Africa does not have any cancer treatment facilities. It basically provides cancer care, hospice care, and facilities for cancer patients while they are undergoing treatment. So these are basically facilities away from home accommodation at cancer care homes. So most of the patients who come from rural areas are put up at these cancer care homes to cover their expenditure and stay while they are undergoing treatment for an extended period. So they are charged a daily fee based on their financial status, and guests stay for an average of 6 weeks, receive meals and transport to and from cancer centers. Such facilities are not provided by the state. So it's all private or non-government organizations. So this chart, it's a bit small, shows you just a part of Cape Town. where the red indicates the number of cancer facilities in the area. And 80% of those facilities are private or non-government organizations. These include the Cancer Association, St. Luke's Hospice, the Childhood Cancer Care Foundation, Cancer Buddies, and other non-profit organizations who provide facilities to look after cancer patients during the treatment. So the way forward, what do we do to address the challenges to universal cancer equity in Africa, to improve the chances of longer quality survival times of cancer patients? We need to address the fact that access to quality cancer treatment is the privilege of those who can afford private health insurance. There is a move by the government to move to the British NHR-like system, but it's doubt whether that will be an efficient and effective system, because anything that the government runs can be done privately for a tenth of the price. So we need to improve awareness raising and education on cancer to the general population. We need to increase the spending on research towards lowering the cancer risk for groups that are already at high risk. We need to ensure equitable access to cancer care in South Africa and the continent. But more importantly, governments in Africa are not taking ownership of the problems that the continent face. Governments need to take ownership. We need to see increased government spending on preventive cancer treatment and research. And how we do that is maybe something we can discuss in the open forum. And that the picture doesn't look very promising, but those are the facts and something that we need to be aware of and look at how we can address them. Thank you very much for your time.